Hello everyone, I'm Dr. Roman and welcome to encouraging case number 6 about a patient with colon cancer. So for those of you who are not familiar about my encouraging case series, I present to you a case about a patient with cancer who is doing well. And the reason for this is because I constantly see patients that tell me when I first see them and they're given a cancer diagnosis, they automatically think that they will do poorly. And I want you to know that that is not the case. They are patients that do well. And in these series, I am picking out extremely aggressive cancers whom are doing extremely well. And this is important because it gives us hope. So, of course, as with every other case, I asked for permission from the patient, and the patient told me, quote, if my case can provide comfort or help somebody else, by all means, present it. As in every other case, all personal information, of course, will be kept anonymous. So with that being said, let's dive in. So very interesting case. I was called by the surgeon to see this patient as soon as possible because this tumor at the time of surgery was nasty. The surgeon's words. Very nasty tumor, wanted me to see this patient as soon as possible. So I saw this person in their early 50s after surgery, and the surgery was done in December of 2021, and they were diagnosed with a colon adenocarcinoma. So this is by far the most common type of colon cancer. At this time, he had a pathological T2N2, so very aggressive tumor. 18 lymph nodes were removed, and out of the 18 lymph nodes, 7 had cancer. So I want to take a little time here to just talk to you about colon cancer. And if you want more information or you want to learn more about cancer of the colon or rectum, I encourage you to find my video titled Colon Cancer or Rectal Cancer in my channel, where I go into much more detail. But in general, colon cancer is divided into 4 stages. Stage 1, which is the earliest stage, and stage 4, which is the most advanced stage, where you have metastatic disease. Of course, stage 2 is a little more advanced, stage 3 is much more advanced, and then ultimately you have stage 4. So in colon cancer, if you have lymph nodes involved with cancer, you're automatically a stage 3. And the more lymph nodes you have involved with cancer, the worse the patient tends to do. Because colon cancer likes to spread from the colon to the lymph nodes, and then from the lymph nodes to the rest of the body. And the reason this is a fascinating case is because unfortunately 18 lymph nodes were removed, but 7 were involved with cancer. So that's an awful, it's an awful lot of involved lymph nodes with cancer. So the patient came to see me and we had the discussion, what could we possibly do to try to prevent this cancer from coming back? And unfortunately, the answer is adjuvant chemotherapy. Adjuvant meaning chemotherapy after surgery to try to prevent the cancer from coming back. So after this discussion, the patient agreed to have capecitabine, which is an oral chemotherapy, together with oxaliplatin, which is another chemotherapy given intravenously. So needless to say, 2 different types of chemotherapy, and we plan to give a minimum of 6 cycles or 3 months of chemotherapy to a maximum of 6 months. So 3 to 6 months. And the patient, after 3 months of therapy, told me, you know what, doc, I'm tired, I'm beat up on, I don't want any more chemotherapy. And we do have literature now stating that 3 months of chemotherapy adjuvantly for colon cancer, meaning chemotherapy after surgery for colon cancer, might be as good as 6 months. So after 3 months, we stopped, we let the patient recover, and we've been following the patient since then. Remember, I said the patient had surgery December of 2021. Well, here we are, March of 2025, and thus far, this patient's scans are completely negative, meaning we don't find any macroscopic disease. We don't find cancer on imaging tests, which has included PET scans and CAT scans. And I've taken it a step further. I also follow this patient for circulating tumor DNA in the blood. So this is simply a blood test where we look for that patient's cancer in the blood. So for those of you who want to learn, your cancer, the cancer that you had, tends to shed off DNA into your circulation. And we can look for your specific cancer's DNA in your bloodstream. So the cancer that you had in this case, we learn, or we know the DNA of that tumor, and we look for it in your blood. And if we find it, even in very, very low numbers or quantity, that's usually not a good thing. That means that you still, unfortunately, have cancer somewhere in your body. Well, thus far, March of 2025, this patient's circulating tumor DNA test is negative. That's right. On imaging tests and on blood, we do not find cancer. And needless to say, this patient is ecstatic, and of course, so am I. So here you have another example of a patient with an aggressive cancer, in this case, an aggressive colon cancer or advanced colon cancer, who is doing wonderful. They're going back to their daily routine, and you know what? They are enjoying life. So I hope that this case presents or brings some hope to you, and that it's able to help you. And I will tell you this, and I've said this on other videos. I'm an oncologist. I'm seeing cancer patients every day. And there are two types of patients with cancer: those who are positive and those who are negative. And guys, I can tell you, patients who are positive, for whatever reason, because I don't have a scientific explanation for this, but those patients who are positive usually tend to do much better. So keep that in mind. Consider subscribing, watch my other encouraging case videos, and all the best to you, and I'll see you on the next one.